Why have you barely increased health spending in Scotland since 2008?
Health spending, revenue side, has increased in real terms every year. It's about to hit 12 billion for the first time, and if we're re-elected, it will rise in real terms every year in the next Parliament as well. Andrew,
how much has it increased in real terms every year, Mr. Hosie?
Well, I don't have that figure, but
okay,
the revenue budget spend is a real terms increase.
Well, you've just claimed it, and I'll tell you. Health in 2008, just the year after you came to power in Scotland, was 11.7 billion in Scotland. By last year, it was 12.1 billion. This is in real terms. That's an increase of only £300 million in real terms. It's peanuts and much less than the increase in England.
Well, I have to say, given we have had a government subject to quite extraordinary cuts in revenue and capital from London, the fact we've been able to protect the NHS and deliver a real terms increase every year and a future real terms increase planned is a remarkable achievement given the pressure, the downward pressure by George Osborne on the Scottish budget. That's something we should be proud that we've managed to achieve, not something that should be dismissed in a line.
Why should you be proud, Mr. Hosie? The English health budget over the past 5 years has risen in cash terms by 12%. You've only increased your health budget by 8%. Why are you lagging behind England?
I think well, we're not lagging behind England. We have a different health service. We've fully maintained it. We've stopped the privatisation of it. We're not going ahead with the daft junior doctors' contracts. We've taken the private sector out of cleaning our hospitals and reduced hospital-acquired infection by around 80%. We're seeing more patients than ever before. We've an increase to 137,000 employees in the NHS. This is a very strong record. Well, and better, I think, Andrew, to recognise the achievements than simply talk the NHS down.
Except that in terms of increased spending, health spending in Scotland is increasing less than it is in England. As a share of government spending in Scotland, health spending has been falling. It's been rising in England. And one of the consequences is that in terms of waiting time targets, you haven't hit them in the A&E since September 2009. You have missed for 6 years in a row.
I think you'll find that when the targets were met, the target was actually increased and strengthened.
You haven't met it since 2009.
That's because we set an increased target, Andrew.
But you failed to meet.
A more tough target. A better target.
What?
Yes, but the thing about these targets is you aim to get to them. You put the investment in, you increase the number of GPs and nurses and doctors and consultants, staff across the piece to constantly try to improve, and challenging targets are set to do just that.
Let me just take the Queen Elizabeth University Hospital in Glasgow, huge hospital in Scotland's biggest city. Its records show that it's now meeting waiting times for only 77% of patients, whereas the target's 98%. It hasn't got the money, it is failing, and it hasn't got the money because you've not spent the money on health in Scotland.
Well, I dispute that, and I think it's completely
you dispute
wrong,
the Queen
Andrew,
Elizabeth figures?
It's completely wrong, Andrew, to choose a single hospital and pretend that that is instructive of the entire NHS.
Not if you're in that hospital on a Friday night, it's not.
Well, to pick one hospital and one busy Friday is an even more facile argument than look at the NHS across the piece. I'm not sure why you're doing this,
since
Andrew.
2009. That's my point. I only picked one hospital to give you an example. Take every hospital, you haven't hit the target.
Well, that simply isn't the case. It's simply not the case to say not a single hospital has hit the target.
No, I said take the average of all the hospitals, you haven't hit the target.
Andrew, we set more difficult targets to drive up quality.
All right.
It was the right thing to do.
Can I just, I don't quite understand this, because in terms of as a share of public spending, health spending in England has risen in the past 5 years from 19% of total spending to 20%. Now that increase, it's a 12% rise in cash. That's reflected in the Barnett formula that gets sent to you. You get a share of that increase. And yet you have chosen not to spend that increase in health. Well, you've cut the share of spending on health.
Again,
why did you do that?
Andrew, Again, Andrew, you're pretending there's been increases. The Scottish budget has been cut across the entirety of the last Parliament, and we're facing something in the order of 5.2% real terms cuts over this Parliament.
But Mr. Hosie,
to choose a change in revenue in one department and pretend there's been an increase in the amount of money the Scottish Government has to spend simply isn't correct.
What could be more important than health, which is entirely under your control? And in terms of the share of health spending as a percentage of total public spending in Scotland, whereas it's risen in England, it's fallen from 18.3% in Scotland to 17.3%. You have been cutting health as a share of public spending. And I ask again, why would you do that?
It is extraordinary. While there has been a real terms increase in health spending and resource spending across the Parliament, which you've conceded, you're now trying to suggest a real terms increase in health spending in Scotland is a cut. It's the wrong argument, Andrew. I don't know why you're doing this. I don't know why you're pretending the NHS is in crisis when it is not. You need to accept, as you have, there's been a real terms increase in NHS revenue spending, and that was the right thing to do.
You're proud of a real terms rise of a paltry £300 million over 6 years. Works out at 50 million quid a year in a budget of 11.7 billion.
I think when we take the budget, we increase it each year, we end up spending 12 billion for the first time on the NHS in Scotland, when people are incredibly satisfied with the service they get.
Really?
To have it talked down in such an abstract way is a bizarre approach to be taking.
Okay, it wasn't abstract, Mr. Hosie. It was using the figures of your own Scottish Government. These are the official figures. But we better leave it there. Thank you for joining us. Enjoy your time in Aberdeen. I rather envy not being in Aberdeen too. It's a great city. Thank you.